This is modified Dix Hallpike test. So why I'm using modified Dix Hallpike test is actually very good test for person who are having back pain or someone that having a problem with the neck and everything. So the first thing you have to make sure you have a very good pillow. So good pillow, then you need to flip this pillow like this. And let's say you want to do to the left modified Dix Hallpike test. You can ask patient to turn to the left side and you see the arm and down. Make sure the head is touching the back. So this is very important. Then you need to visualize patient's eye. There is no vertigo, no dizziness, no nystagmus. Then wait. I think in this patient, it's not enough in terms of the thickness of the pillow. So you have to make sure you have a better pillow in your clinic. Alright, and up. Okay, so this is quite clear example for modified left modified Dix Hallpike test. Let's say you want to do right, so like this and down. But it's supposed to be you have to sit on the other side. Alright, then you see. That's all. So this is left modified Dix Hallpike test and this is right modified Dix Hallpike test. Okay, and up. Good. What we call roll test. Roll test is actually assessment for the horizontal hemisphere. So the first thing before you need to do, you need to have something that lift up patient head, which is like the 20 degree. So let's say if you want to do right roll test, just to investigate is there any horizontal canal BPPV, and you can see and visualize your eye. So if there is a horizontal nystagmus, this is a considered positive. Actually you can BPPV. Then turn to the center. Then you need to repeat the left sides of the roll test. So you need to visualize the eye, something like this, and you need to wait for any symptoms of dizziness, vertigo, and also nausea and vomiting. And you need to wait. Let's say in this patient they have a positive. So the treatment for this patient, this is what we call barbecue maneuver. Okay, let's say your patient are having positive left horizontal canal BPPV. So the first thing you need to turn patient head contrary to the other side, and you need to wait. But at the same time, you need to ask patient to make sure the chin is touching the chest, something like this. But you can help them, okay. And after that, turn the body, turn the body, and then turn the body, right? Turn the body. Let the body like it, good. So so this is what we call barbecue, but you have to make sure the chin is close to the chest. The chin is close to the chest, something like that. So it's quite tiring, but you need to wait. And alright. And you have to wait for the sometimes and then turn control the center. This side, good. Okay, something like this. So this is what we call roll test. Roll test, that means you have to rotate the patient head 360 degrees. You could remember 180, 90, and up. So this is what we call roll test. Okay. Semen test is actually one of the treatment for posterior canal BPPV. So the first thing you need to ask patient to sit at the back of the back, and you need to sit in front of patient. Okay, let's say the patient are having right BPPV, right posterior BPPV. So the most important thing, you need to turn patient contrarily to this side, okay, to this side, and then you need to make sure next step you need to down the patient, his face out. This is the most important thing, down. So this is semi-binaural. So when you are down, you have to look at patient's eye and see and observe any nystagmus or any dizziness in this patient. Okay, then when all the dizziness, nystagmus is stopped, then you need to be suddenly down to this side and make sure the nose is downward, touching the back. Alright, so this is simple. This is one quite simple test, but it's very good. See, the recovery is only, the recurrence rates are 4%. Okay.